oncofetal gene sall4 in aggressive hepatocellular carcinoma by Gibson's Rita Vega. Hepatocellular carcinoma is the third leading cause of cancer-related deaths worldwide. In the heterogeneous group of hepatocellular carcinoma, those with characteristics of embryonic stem cell and progenitor cell gene expression and associated with the worst prognosis. The oncofetal gene sall4, a marker of a subtype of hepatocellular carcinoma with progenitor-like features, is associated with a poor prognosis and is a potential target for treatment. We screening patients obtaining from patients with primary hepatocellular carcinoma for the expression of sall4 and carried out a clinical pathologic analysis and loss of function study were then performed to evaluate the role of sall4 in hepatocellular carcinogenesis and its potential as a molecular target for therapy. To assess the therapeutic effects of a peptide that tires sall4, we use in vitro functional and in vivo xenograph assays.
Hi, my name is David Mulligan, and I'm the director of the Transplant Center and chief of transplant surgery here at Mayo Clinic in Arizona. I wanted to talk to you today about a bad disease, hepatocellular carcinoma, or liver cancer. And it's a cancer that arises in the liver, and it most frequently occurs in patients who also have cirrhosis. So most of the time when they have liver cancer, they also have other liver disease. Many of times it's going to require a liver transplant to help these patients be cured of their disease. When patients have liver cancer and cirrhosis, a liver transplant is only possible in this country when their disease is caught very early. It's called a Milan stage 2 disease. But basically, in lay terms, that means that the disease is very small and it's caught very early before it's had the chance to grow into a sizable tumor over 5 centimeters or more than 3 tumors, none of which are greater than 3 centimeters. So when you have a lot of tumors and you have a problem, you have disease that is going beyond what we can actually accept as a transplant candidate, most of those patients are out of luck. But in this part of the country, in Arizona, we're fortunate to be in a region where we have an aggressive protocol that allows us to use chemotherapy, radiologic interventions, and other technology to try and attack these tumors and show that we can provide some shrinkage. Now that
sall4 is an oncofetal protein that is expressed in the human fetal liver and silenced in the adult liver, but it is re-expressed in a subgroup of patients who have hepatocellular carcinoma and a unfavored prognosis. Gene expression analysis showed the enrichment of progenitor-like gene signatures with the overexpression of proliferative and metastatic genes in sall4 positive hepatocellular carcinoma. Loss of function study confirmed the critical role of sall4 in cell survival and tumor genesis. Blocking sall4 core-expressor interaction relates to the suppression of PTEN, the phosphorylates and tension homology protein, and inhibited tumor formation in xenograft models in viral.
This is an absolutely beautiful teaching case, and you'll soon discover why. Notice we have in the northwest an area which looks bluer and more uniform, and notice that here along the south and east we have an area which I think I could quickly convince you is not only liver tissue, but because there are so many irregular thick bands of scar tissue between these liver lobules in an irregular fashion, that this is cirrhosis. No problem, slam dunk easy diagnosis. We all know the various things that might cause cirrhosis. We're not going to repeat that. But we should also know that many, if not most cases of primary liver cancers or hepatomas or hepatocellular carcinomas arise in the background of cirrhosis. And perhaps you might want to think of it as that these nodules have been regenerating so long, maybe something happens to them as well, which makes them regenerate in the fashion of uncontrolled growth, which is called cancer. Here is the cirrhotic liver, and here is the cancer. What is the difference? Well, the cirrhosis is slam dunk easy. You can see cords, maybe remnants of sinusoids. You can see it's all separated by irregular nodules. They're very small. I suspect this was micronodular. But in this area here, we see that the hepatocytes don't really look like hepatocytes anymore, do they? Sure, they have the same cytoplasmic staining. Look at how the nuclei are irregular and no longer form cords in the tumor like they do down here in the cirrhotic liver. Also notice that these nuclei are still generally uniform, but look at the nuclei within the hepatoma. Thank you very much.
Conclusion. slla4 is a marker for a progenitor subclass of hepatocellular carcinoma with an aggressive phenotype. The absence of slla4 expression in the healthy adult liver enhances the potential of slla4 as a treatment target in hepatocellular carcinoma. Um,
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 578, Rapid Review.
What is the most common cause of hepatocellular carcinoma? The most common cause of hepatocellular carcinoma is a cirrhotic liver, which is associated with hepatitis B and C and with alcoholism. What is the most common hereditary bleeding disorder? The most common hereditary bleeding disorder is von Willebrand disease. What is the most common hereditary harmless jaundice? The most common hereditary harmless jaundice is Gilbert syndrome, which is also known as benign congenital unconjugated hyperbilirubinemia.
Thanks for your attention.